Hey everyone, welcome to the Freedom to Flourish podcast. I'm Dr. Joel here with my awesome friend, awesome colleague, Dr. Tim Augustyniak. Today we're talking about viruses. The last several episodes, we've gone into the different infectious agents, talking about fungus, bacteria, parasite issues, and now we've got to talk about viruses. So we'll talk about viruses in a couple different senses. Obviously, in a general sense, we'll talk about what they are. We'll talk about where they come from. We'll talk about the signs and symptoms that kind of point to virus issues. Obviously, we'll get into the acute and chronic symptoms and all that good stuff, how to test for them, and then, of course, how to address them. We'll talk about a couple big ones like EBV. We'll talk a little bit about COVID, and then we'll talk about shingles as well, the herpes zoster virus. And then we'll get into some other things, right? So obviously the common respiratory viruses, and then even some of the different sexual STD viruses as well. Those are also very important to talk about. Dr. Tim, obviously we're excited about this one because we see a lot of patients come in with viruses, but let's kind of jump right in and talk about viruses. Let's kind of jump right in and talk about what are viruses, where they come from, and just kind of start moving with things.
Yeah, absolutely. Viruses are a little bit different compared to all the other infectious agents that we've talked about, in that they actually can't really survive on their own. They can't replicate their DNA and all that stuff. They must be within the cell of an actual living organism. So viruses aren't technically alive. They're just these little protein DNA bundles that will actually just replicate based off of being within an already living cell. So when bodies go through and kill these off, it'll actually have to destroy the cells within our bodies that contain the virus in the first place. So that's why when you get flu, your body just aches like crazy. And it's because the flu virus is all over your body and in all kinds of cells, and your body is actively destroying those cells. So there's a lot of different forms of viruses. There are spherical ones, there are helical ones, which are just kind of the traditional like DNA kind of spiral type shape. There are some that are called bacteriocides that are basically more complex structures that almost look like a spider, I guess, with a big head on it. But they all tend to function the same way. They have some sort of process of injecting themselves and the DNA into a host cell, and then from there they can replicate and grow. The thing with viruses is they can, just like any other pathogen, they can really be in all sorts of different locations, we'll say. So you can get infected through all sorts of different ways. Environmental things, viruses are, I would argue, a little bit different. So you can get a lot of them just from coming in contact with surfaces that have the viruses on them. So if somebody, say, were to sneeze or cough in their hand and then shake your hand, or say somebody sneezes and it's in the air, the saliva, the aerosol spray that comes from that is in the air, you can breathe that in and take it in that way. But then also, depending on the strain of viruses, there's respiratory ones. There are more, sexually transmitted viruses like HIV, HPV, herpes simplex virus, all that stuff. All those things, it's more so sexual contact as opposed to just, being in the vicinity of somebody who's breathing out, some infected, essentially aerosol spray from sneezing, all that stuff. So anyway, there's a lot of different ways that you can come into contact with viruses, and it's just a matter of making sure that you practice good hygiene and stay away from people that are sick, stay home. And then also when it comes to the sexually transmitted ones, well, there's ways to avoid that. So plenty of different avenues. So there's many different kinds. So why don't we just kind of jump into maybe getting into each of the different categories that we've divided these things into.
Yeah, for sure. And you've already broken down the majority of that there, right? And talking about, hey, we've got these respiratory viruses, which usually when people say viruses, that's usually where their first thought goes to is getting some kind of sickness, getting congestion, runny nose, maybe something with the lungs, things like that. And that's kind of the most common probably topic that we'll talk about. We have maybe the more chronic / more serious category that we'll have here as well, and then the sexual category, which you kind of went through there. With the respiratory, the types of viruses that we're talking about are things like influenza. We're talking about the adenovirus, cytomegalovirus. Technically, Epstein Barr virus is included in that as well, but we include that one maybe more in the in the chronic / kind of more serious category. The rubella virus, rotavirus, poliomyelitis virus, varicella. There's a number of different things here. Of course, COVID virus as well. But all of those kind of go into that respiratory category. The more kind of serious, kind of chronic viruses, which we view as generally maybe a little bit more difficult, I would say, is going to be the Epstein Barr virus, and then the shingles, the Herpes Zoster virus. And then you went through the sexual viruses there, HIV, HPV, HSV, and all those guys. One of the things when it comes to viruses, and we've talked about this, Dr. Tim, with the parasites and the bacteria and the fungus, that we continue to reiterate when it comes to these different infectious agents, is that we oftentimes, yes, the exposure and how much you're exposed to these infectious agents is important, because that's how much maybe stress is coming against or demand is coming against your immune system. But what we always emphasize and focus on is your immune system and the overall strength of your immune system. If your immune system is strong, you can be around some of these different things and not get sick. And of course, I know we mention that in almost every episode, but we always talk about how, yeah, it is a little bit of a balance as well, right? I mean, if your immune system is kind of strong, but you're around all kinds of ridiculously sick people, the chances that your immune system is going to have to fight pretty hard is really high. And so the more that you're exposed to, the more demand that's placed on your immune system, essentially the stronger your immune system needs to be. When it comes to patients, when it comes to family and loved ones, my personal stance is I'm always making sure that my immune system is as strong as possible so that I can help these people not have to worry about myself getting sick. And I think that is, I kind of wish every doctor had that same stance on things. I know during COVID, we got to see some of the true colors of a lot of physicians. I've heard some horror stories about doctors bringing out, like, for example, prescriptions out to the parking lot wearing a hazmat suit. And it's kind of wild to think about some of that. But nonetheless, those are the different categories there of the viruses. Dr. Tim, any other thoughts there before we kind of jump into these signs and symptoms of viruses?
Not especially. I just think it's important to highlight that, depending on what types of viruses you're dealing with, there are going to be a lot of different signs and symptoms. There's going to be a lot of crossover, especially when it comes to the acute phase versus the next phase of viruses. And what causes those to manifest is oftentimes just the ability for your immune system to tolerate fighting things off. So that just kind of goes back to, we talk about it all the time, but, since we haven't really touched on it in a ton of detail in quite a while, I think it's probably out of all the infections important to note with viruses, the balance of the immune system. So what we like to talk about is just the two sides of the immune system that regulate your ability to fight infection, as well as your hyperreactivity to more environmental things your body's dealing with, or non-infectious agents for the most part. So the first side, your Th1 cells fight off infections, and your second side of the immune system, which is your Th2 cells, and those deal with environmental things like mold, metals, mycotoxins, allergens, parasites, pesticides, those things, as well as internal environment issues like gut, bladder, sinus issues, or infections in there. So once the immune system goes up, the other goes down. So whenever you have a lot of these environmental things that are causing hyperreactivity on that side, and maybe things like eczema or skin issues or gut issues, food sensitivities, all those things to get worse, that side of the immune system will go up, and then the other side will go down. Well, if side number one, or your Th1 cells, go down, that means that you're not going to be able to ramp up an attack against all of these viruses. So it can make a very acute virus like, a cold, flu, COVID, you name it, really, really difficult to fight off. But then at the same time, It's when it comes to chronic infections, things like that are more lying dormant in the spinal cord, things like, herpes simplex virus, cold sores. That's when those things can actually come out. So it could be a sign that if you're getting frequent cold sores, that your immune system is just tanked from some sort of environmental issue or even hormonal issue. So the one thing that's going to actively depress the Th1 cells is stress. And when we say stress, it's not just emotional stress. It's not just life. And don't get me wrong, that's going to play a big factor in it. But it's also blood sugar issues. It's also your ability for your liver to detoxify cortisol and estrogens and all the other hormones that detoxify through those same pathways. So if you're, having really irregular periods, maybe some like dark hair growth, maybe some excess testosterone and insulin going on, all those are going to make that chemical stress worse for you and can make it more difficult for you to fight off these infections. And so it's very important to note that, managing your hormones, managing blood sugar, but then also dealing with those things that are not necessarily infectious are super involved with balancing the immune system as a whole. So you don't just get sick randomly. Like you said, if there's a lot of different viruses that we're going to be exposed to, we need to make sure that our immune system is ready and prepared to fight these things off. And there's various signs and symptoms you can identify that will contribute to it being more a chronic low-grade viral infection, or just other constitutional symptoms that will lead you to believe that you're susceptible to getting sick, all those things. So, and that's kind of, I guess, setting the stage for what we would like to get to with the acute versus the chronic stage of viruses. Because when you get sick and things ramp up and you get what you think of as being like flu, cold, you name it, it's a lot different than what you would think of as like a chronic virus. It's not like those symptoms just last and stay the same. They tend to change and be a bit different. So why don't you start walking us through what sort of signs and symptoms are involved with acute as well as chronic infections?
Yeah, I love that you said you don't get sick for no reason. That's one of the biggest things I emphasize with patients is like these things just don't happen for no reason. There's some kind of weakness, something there that needs to be addressed and strengthened. And when I share that with people, it kind of gives them hope. I think a lot of times when people get sick, they kind of feel like it's just something that happens to them. And it's like, no, you can do something about this. So jumping into the acute symptoms here. So when you get sick, most of the symptoms we think about with viruses, these are going to kind of fall into the acute category. The sickness, you might have a fever, you might get congestion, a runny nose, postnasal drip. You might have aches and pains throughout your body. You might not sleep very well. You might get a headache, that kind of thing. It can affect your nervous system so much so that your gut can actually be thrown off. You have some diarrhea, you have an achy stomach and things like that. And then every once in a while, you can get rashes that also pop up with these viruses. Now, those are generally the acute. And when we talk about acute, we're talking about generally around 2 to 4 weeks. Once it generally passes that time frame, I think some people might actually consider that even to go up to 3 months with that. But once it generally passes that short-term time frame, we get into this kind of chronic category. That's where we're talking about fatigue is usually going to be one of the top symptoms there of, hey, you've got this virus that's still there. You might not have a fever anymore. You might not have congestion, but it's still there. It's still running your immune system down. It's running your nervous system down. Fatigue is a huge symptom. Postnasal drip can stay there for quite a while. Canker sores is also a sign that, hey, there may be something going on with viruses still. And skin warts. Those are some of the top ones, I would say. The ones that I would say probably the one that gives the people the most trouble, Dr. Tim, from what I've seen, is probably the fatigue. Most people are aware of warts being caused by viruses. Most people are aware of the canker sores being caused by viruses. Postnasal drip, usually people aren't super aware of that one, but the fatigue is one that can be kind of trippy because, a lot of people have busy lives anyways. Maybe people think that there's just something going on with their sleep. Maybe they think that their stress is finally getting to them, whatever it may be. But if in reality, if you trace it back, and this is what I encourage people to do, is remember that nothing happens for no reason. And so trace it back. When did this fatigue really start? Oh, well, it started last winter when I got sick with XYZ. And that's usually a sign that, okay, there's probably something still going on with the immune system where your body hasn't fully recovered with that. That's the majority of signs and symptoms, Dr. Tim. If there's any other ones, I want you to jump in. The main one that I didn't touch on here, but of course is also important, is in regards to the STD viruses, right? So those I don't feel the need to go into too much there, but obviously you can have just different cold sores, different skin issues, things like that in the genital area, sometimes even in the oral area and things like that. Dr. Tim, anything else to add to some of those signs and symptoms that you really try to encourage patients to, hey, when you see this, it could be virus related?
Yeah, well, I think it's important to talk about maybe that list of different types of viruses and some of the more specific ones that we mentioned and signs and symptoms that go with that, at least
Yeah,
as far as it goes for well, symptoms, but then also how you get these viruses a lot of times. So with the flu, most people know what the flu feels like. It's you get body aches, you get fatigue, a lot of times cough, sore throat, all that stuff, fever, all those things are on the list. COVID, pretty similar. A lot of people will note like pretty bad headaches, pain behind the eyes, things like that. But then also with COVID, we got to watch out for things like long hauler COVID, where you get that very acute cytokine storm that's produced to fight off COVID. But there's a process in the liver called glycination that helps detoxify these. And if you don't provide your body with sufficient glycine and different cofactors to clear that out, you can actually get a bottleneck of these cytokines. And then that way you'll not be able to finish fighting off COVID. And that's how long hauler COVID starts.
And what are the main symptoms of that, Dr. Tim, that patients they've probably experienced?
Yeah. So, well, one, you just never really bounce back after COVID. One of the biggest things that kind of points us to that is, well, I got COVID and I never felt the same again. Whether that's fatigue, whether it's chronic postnasal drip, whether it's any sort of chronic issue following that, hormone issues. I've seen people where their heart rate, blood pressure are both elevated. I mean, heart rate will be like 100 and blood pressure will be like 140 over 100 consistently after they get COVID. And they take a bunch of glycine to clear out that cytokine storm and things go back to normal within a couple, like 2 weeks.
Awesome.
It's incredible. So if you want to solve that problem, that is the top nutrient on the list for that. So anyway, that's COVID, long hauler COVID, all that stuff. Now, the issue with that is if you don't deal with that in a timely manner, you can get where other co-infections will creep in because your immune system just won't fight those off as well. So you can have, say, COVID, you can have a cold, you can have a flu bug, you can have all these viruses that your body is dealing with that you aren't able to ramp up a Th1 response against them. And therefore, they just hang out in the background and replicate and just wreak havoc, cause fatigue, weight gain, downregulation of the thyroid, adrenal issues, all that stuff. So it really is important to deal with those things in a timely manner, but kind of besides the point. Mainly just identify when it happens, deal with it when it comes up, and then from there, those are what the symptoms can look like. So that's long hauler COVID, but more chronic and we'll say like serious infections, things like that, like cytomegalovirus. Once you're infected with that, it lies dormant in your body your whole life. And this one can be one resurface and just kind of cause low grade fatigue, things like that. But it's more so just involved with chronic significant inflammatory issues. If you have stress, a lot of hormone issues, and a lot of immune system things that are kind of stacked against you, that can kind of resurface and problems where you need to work through and do some antiviral herbs to calm that down. The same goes with Epstein Barr virus, or a lot of people know it as infectious mononucleosis. So that is transmitted through saliva. That is the only way to get it. And so typically it's from kissing, it's from drinking out of somebody's drink, it's things like that. And one of the most telling symptoms of this is splenomegaly. And that probably doesn't sound like a whole lot to our listeners, but think of it as like mega spleen. So your spleen will swell and become pretty fragile. Basically, it's kind of like a water balloon fight. If you fill up a water balloon way too big, it's really tight and it's going to be really, really likely to burst. And so that's where if you do have mono, especially kids that are in high school, no exports and all that stuff until it's calmed down, the spleen has gone back to normal. And that can take like 6 weeks to 2 months. sometimes longer. So very, very important to understand that. But then with shingles, the other one on the chronic list that we have, shingles is just a manifestation of the chickenpox virus. More often than not, it is a resurfacing due to chronic stress or something that dampens the immune system in the short term that allows that thing to creep back in. And this will manifest as basically just like acute chickenpox along what we call a dermatomal pattern. So the way that the chickenpox virus enters the body is, the virus will enter through the skin wherever it's in contact, and then it will latch onto a nerve, and it'll creep its way up that nerve, and it will lie dormant in the spinal cord at the same level where that nerve is, or at least close to it. So say you got the chickenpox vaccine in your right arm. Well, you'll probably end up getting shingles somewhere along your right arm, or even like through your chest or back near that level where your arm comes into your spine. Typically, it is like upper chest if it happens on the chest, or it goes down the arm. I actually had shingles resurface a couple years ago when I was in school, and it was actually low back and kind of wrapped around a little bit to the side, top of my glute. And I actually got some pretty bad pain and like searing pain in my hip because of it. Because actually, when I was a kid, got the chickenpox vaccine in my thigh. They used to give me my vaccines in my thighs because I didn't like shots. So anyway, it's a matter of where you get that. Then the last category, sexually transmitted viruses. HIV is mainly just going to be classified with immunosuppression. So all in all, if you do have HIV, you're going to be getting sick a lot. And so they're going to test for all that stuff. If you go to your primary care and you're just sick all the time, they'll probably run that, especially if there's, numerous sexual partners, things like that over the years. And they have their way of treating that where they actually have some really good medications that basically make it not transmissible and all that stuff nowadays. So that's really good. But the main thing is immune suppression. But then HPV. So I wanted to highlight HPV because there are over 200 strains of HPV. And there's a vaccine for it. And they push this vaccine like you would not believe. Young girls, they go, you need the HPV vaccine because if you get HPV, your risk for cervical cancer goes through the roof. And it can mess with fertility, all that stuff, especially if you have to get your uterus removed because you get cancer there. Well, the problem is the vaccine only covers 9 of these 200 strains. Wow. So the only real way to avoid this is to practice safe sex. So, ideally, as few partners as possible. Various forms of contraception, condoms, things like that to block, transmission there. The real true way to keep from getting that, because all those are flawed ways, is just don't do it until you're ready. And that will greatly reduce that risk. So, just important to highlight there. So why get a vaccine if it's, basically what percentage is that, like 5% effective, if even. But then when it comes to herpes simplex virus, cold sores here, cold sores in the genital area, all that stuff, it just requires contact. It can also be transmitted through viral shedding. Somebody who sheds that virus a lot near the area where you get cold sores, so you get herpes simplex 1 cold sores, lips, mouth, all that stuff, can be transmitted elsewhere if you are viral shedding or experiencing cold sores, all that stuff. What I mean by viral shedding is you're not demonstrating symptoms, but your body will actually be letting off the virus. And so that's a lot of times how these things can be treated without action. But then hepatitis B, last little bit I'd like to get to here. Hepatitis B, main symptom with that is you're just going to get really sick acutely, and you're going to get all kinds of liver pain for quite a while. And so you can get where anytime you have any stress or drink any alcohol, you name it, for even months after you get this, you can get pain over where your liver lies. It's right underneath your ribs on the right side. And you basically just have to wait it out, do some antiviral herbs. At least with medical doctors, a lot of times, at least from what I've heard from patients in my own research, there are some antivirals that they'll prescribe, but it doesn't really tend to solve things. It can help, ease symptoms in the short term, but you still have to just kind of let it ride itself out. So plenty of different symptoms that go with this. You know, the whole reason I wanted to go on this tangent was if you're experiencing weird fatigue and all kinds of constitutional symptoms, can be because of chronic infections, but then also each of these infections has their own telltale, like, all right, that's that virus. But then the question is, how do we identify these and fix it? So that's kind of the next little point that we want to get to with these things. So, Dr. Joel, do you want to walk us through blood testing and how we can identify these things there?
Yeah, absolutely. So one thing that we always talk about when we talk about identifying infections is usually through signs and symptoms and a history. I would argue that a good doctor should be able to say, hey, it's most likely this. And then the next step might be, hey, let's run some blood work to confirm this, or let's jump into muscle testing to confirm this, or whatever it may be. And so when we talk about, again, signs and symptoms, those are always things we're keeping in mind. Of course, the history is important based on the timeline of everything. But when we jump into the blood testing, here's kind of the basics with viruses. You can check for antibodies against these viruses for almost every virus. And so if you run the antibody tests, let's say, for example, it's for, let's say, Epstein Barr virus, you'll be able to check, has your immune system been exposed to this and created antibodies? And that's a sign that, okay, your immune system has come across this at some point. Now, there's a couple things with that are important to know. There's different immune system markers that are going to tell you whether this is a very acute issue or if this is more of a chronic issue. And so usually when it's about 4 weeks or less, as far as the newness of an infection, you're going to see the IgM, the immunoglobulin M protein, be high or active on labs. If it's not a new acute 4 weeks or less new virus, it's going to be an IgM activity on the blood test. You're going to see IgG. You're going to see immunoglobulin G be more active. And that's a sign that, hey, your body has created antibodies against this, but it's not something that's very recent necessarily. Now, one of the challenges with some of these tests is understanding whether or not the virus is active or not and that kind of thing. So especially when it comes to Epstein-Barr, the one test that you want to make sure your doctor's running is called the early antigen test. And so if that's positive, that's going to tell you, hey, there's been reactivation. There's a number of other tests, IgM, IgG, and things like that. And those tests are good to check. But if you've ever been exposed to Epstein-Barr, which most people have at some point through their life, then you're going to see that those numbers are positive. But that doesn't mean that it's active right now. So that's important. The other general thing that we'll talk about with blood tests is just a CBC with differential. So your complete blood count. So your complete blood count is going to show you your white blood cells, and the differential part is going to show you what percentage of your immune system cells are making up different specific cells. So usually the neutrophils should be at 60%. That's usually going to respond more to bacteria. So if it's an acute bacterial issue, that will increase. Lymphocytes are the main thing associated with the viruses. So we usually want to see the lymphocytes make up about 30% of your immune system cells, your white blood cells. And with the lymphocytes, once it starts jumping up, it's a pretty good confirmation that, hey, we've got some kind of active virus thing. Now, of course, you always want to compare it with the white blood cell count. So, for example, if your white blood cell count is elevated, the general optimal range, I know we've talked about this a little bit, Dr. Tim, but the general optimal range that I'll use is 5 to 8 on the white blood cell count. And so when it starts rising above 8, I know, hey, there's something actively going on. It's more acute in nature and things like that. Then if you look at the lymphocytes and, oh, it's not at 30%, it's a little bit higher, it's elevated to 36%, 39%, maybe higher, 42%. That's a sign, hey, we've got some viruses going on here. On the other hand, if you see the white blood cells dropping down below 5, maybe it's at 4.5, maybe even closer to 4, then you want to look down and you see the lymphocytes have dropped down below 30. Maybe they're at 25, maybe they're even lower. That's a sign that, hey, we've got some virus stuff going on, but this is actually chronic, like it's wearing your immune system down. And so those are some of the things that we'll look at as well. Now, Dr. Tim, I want to hand it off to you in a second if there's anything to add to some of this. But of course, Dr. Tim, we always talk about one of the key ways that we help people figure out what's going on with their immune system, viruses, Epstein Barr, all these different things, is through muscle testing and through testing the nervous system and understanding, okay, what actually is going on here with your immune system. And Dr. Tim, I always tell patients that the blood tests are good to have just that written kind of objective data. But the muscle testing, and specifically using the systems healthcare technique, is where we're actually able to figure out, okay, what's actually here. And then, of course, also just as important is what do we need to take to actually fix this? And because we find such great accuracy and results with that, a lot of times when patients come in and we know there's virus issues going on, I mean, a lot of times we're not even necessarily running the blood tests because we just know from signs and symptoms it's obvious. And then we jump into the testing, figure out what's needed. Their immune system gets stronger, they get over it, and we're good to go. Dr. Tim, one of my pet peeves with our healthcare system today is if you go into a hospital, for example, with some kind of sickness, you as a doctor and a physician, you should be able to pretty quickly tell if this thing is viral or bacterial. And I actually encourage patients a lot to consider this as well, because they can usually tell on their own. If you have the yellow or green phlegm or snot and all that stuff, it's probably bacterial. If you have the clear stuff, it's most likely viral. And so one of my pet peeves is like, people will go into the hospital and they'll have all this sickness going on and they're trying to get help. And one of the weakest, I think, things that our allopathic and medical profession addresses is viruses. I mean, it's like, I can't tell you how many times I've seen doctors recommend antibiotics for someone that clearly has a viral infection. And the thing is, it's not really going to do much for them. And usually it doesn't. They would be way better off giving them vitamin A, vitamin D, and some grass-fed butter, to be honest. And so where, of course, we'll jump in and, check out the different viruses or antiviral herbs. A lot of times I find that this is just one of those things in our healthcare system that is just not very well managed. So, but to bring it back in, Dr. Tim, I know I wanted to see if you had any other thoughts on the labs, and then I kind of side tangent there. Any other thoughts on identifying the infections, and then any other thoughts on anything else I mentioned there?
I think you did a great job of covering that. And to your point, the main concern is how do we fix these problems? That's a big part of the reason why we do things the way that we do them, because a lot of times there's not really good antiviral medications or things like that people can take to really help solve these problems. And so the argument that we always have with the herbs is, do they actually fight things off, or do they modulate the immune system to fight things off? At least ramp up the immune system to mount that attack. And so I truly believe that most of the herbs, at least when it comes to viral issues, they just ramp up the immune system and allow your immune system to fight off what's there.
I agree.
And there's some, like lomadium root, for example, they used to treat the Spanish flu with that in the early 1900s. Exceptionally potent Th1 stimulator, to the point where it can actually cause a fever or cause skin, like red rash, hives almost. I've never seen it actually itch on anybody, so I don't know if I'd use hives to describe it, but just like a red rash. And it's just so potent at killing off viruses and ramping the immune system up that it can cause other issues with it. So you just have to do a lower dose of that. But to a lesser degree, all the other herbs that we recommend for fighting off viruses do have that effect on the immune system, where they ramp things up and allow you to fight it off. So first things first, for fighting off viral infections, the top herbs that I typically see tests and the ones that I'll recommend are things like astragalus root, golden thread, Chinese skullcap, olive leaf, elderberry. All those things are on the list. Hands down, those ones are really, really great. I already mentioned lomadium root. That one's really, really good. I've seen that one wipe out like lifelong bubbling in the ears issues just like that. It really does a great job. I've had people with chronic coughs, just this post-nasal drip thing, where they've done tens of thousands of dollars of chest x-rays and CTs and all sorts of tests, and they can't figure out what's going on. And then we find a sinus issue where lomadium tests gets rid. So plenty of really good herbs, but you already mentioned vitamin D, vitamin A, grass-fed butter, all these things that can help regulate TH2 balance and support the immune system. Those things are helpful as well. So what other herbs would you recommend, if not those same ones?
Yeah. No, those are a lot of the main ones that I also see. Want to clarify, I think you said golden thread. I think you meant golden seal, just to clarify. Is that right?
I meant golden thread.
Oh, you meant golden thread.
Yeah. So
Okay.
honestly, I'm not sure, golden seal is on the list. We put that in the cabinet list for the podcast, medicine cabinet podcast, about things to keep on hand in your cabinets and all that stuff for when you get sick. But quite honestly, golden seal tests as much. As more time has gone on, it's on the shelf and I test it, but I do find golden thread to test more at this point.
No, that's great. That's awesome. And to the listener, I'm always learning more from Dr. Tim, so it's not a surprise here. When it comes to the antiviral herbs, we have a general list of like around 15-ish herbs and nutrients specifically for viruses. And so, yeah, you mentioned the main ones. I would say the top ones that I'll usually see is probably astragalus and elderberry. Those are kind of the top ones. But every once in a while I'll see olive leaf or star anise, also called illicium, maybe selenium, stuff like that. So of course there's other ones. Scutellaria, I would say, is probably another fairly common one as well. One of the things that I always mention when it comes to viruses, and sometimes this is all people need, is just supporting the regulatory part of our immune system. So if you have, sometimes people literally just need vitamin A, vitamin D, some good grass-fed butter for healthy fats and arachidonic acid, all that good stuff. Sometimes they just need healthy fats like omega-3s, so a good fish oil, grass-fed beef, stuff like that. And of course, we talk about this all the time, but most people need protein. I mean, when we talk about the immune system cells, they're called immunoglobulins. The globulin part is basically a protein molecule. It's a protein basis. And so if you don't have enough protein, you're literally not going to have the things that you need to make immune system cells and to have a strong immune system. Okay, to go a little bit further and talk about a couple specific herbs for specific conditions. So with COVID, one of the top things that we've seen with that is elderberry and astragalus. Those have by far been extremely common with things. And then we'll see other things like zinc being really helpful. We'll see camu, which is a whole form vitamin C. We'll see that be extremely helpful as well. And there's other things too, like vitamin A and D is helpful. And then we may see also that the actual like thymus and spleen tissue supplements can be helpful as well to directly support those systems. When it comes to shingles, I would say the top things I see there is definitely going to be astragalus, vitamin A and D. And those three are going to be the top ones. I know there's some other things. I forgot to mention this, superoxide dismutase. Dismuzyme Plus is the name there from Biotics Research Company. But superoxide dismutase is a huge nutrient needed for the immune system, especially with the herpes zoster, the shingles virus. But then every once in a while, I'll see it when there's a really, really active virus as well. That one is huge. When it comes to HPV, a couple of things that can be really helpful. Of course, different antivirals, which we always, any kind of STD, anything there, we always jump in with the muscle testing and check. What herbs may be helpful. Green tea extract has been a really common one as well. And then of course, general immune support is kind of how I would break it down there. Dr. Tim, I think we've covered the majority of things. Epstein Barr, I think, is the only other thing I might kind of mention. I guess Epstein Barr and then kind of the common cold. With Epstein Barr, that's one where it can be chronic. It can be more of a difficult issue. With that, elderberry has generally been huge, and then just immune support in general, along with addressing gut health, addressing any anemic issues, any inflammation issues, things like that. And then again, for the flu, Dr. Tim, we talk about this all the time. There's some general recommendations we have for general sicknesses with the flu, things like that. We always talk about astragalus. We talk about elderberry. We talk about basic immune support. Dr. Tim, is there a top three, like, hey, focus on these if you suspect you might have the flu coming around your house?
I always think elderberry and astragalus are good, but then, like you said, camu, I think is top of the list for me.
Love it. Yep. And I would add in butter, and I'd say that's a solid 4 right there. That will help you generally get over all those things. All right, Dr. Tim, we are running out of time. Let's go ahead and wrap up here. My name is Dr. Joel Miller. The practice here is called Freedom Health and Wellness, located in the Dallas, DFW, Dallas, Texas area. If you have any questions, feel free to reach out to me. You can find my website at drjoelmiller.com. You can find me on most social media platforms. Just look up my name. Any questions you guys have, anything we can help with, would love to do that. Dr. Tim.
I'm Dr. Tim Augustyniak down here at Flourish Functional Wellness Center in Bentonville, Arkansas. If you find me online, my website is draugustiniak.com. That's DRAUGUSTYNIAK.com. On the homepage, I've got links to my socials as well as contact info. As always, if you have any questions, comments, concerns, or suggestions for future episodes, feel free to let us know. We, believe it or not, run out of ideas. So we could use some help coming up with all these topics and all that stuff that you guys want to hear more about. We love the suggestions, and if you guys can think out of the box and help us come up with things, that'd be great. So regardless, thanks everybody for listening. Hope you guys have a good one, and next week we'll have a great episode lined up for you. Bye.
All right.